Namaste. This is Dr. Karthikeyan coming to you once again with this initial series of meeting the doctors. We have with us today Dr. Mohanaselvan, who is one of the senior practitioners of acupuncture and Sujok Therapy. And the whole idea of these series of lectures is to bring these kind of therapies which these doctors are practicing and the benefits of these different practices to the patients. Now, I would like to ask Dr. Mohan his experience of how he ended up being a acupuncture and a Sujok practitioner.
Vanakkam to all. I'm basically I started as a general practitioner. I completed my MBBS in Chennai in the year 1982 and started my practice in 84. I started as a GP and fortunately I was quite successful, and over the next 2 years the crowd was so high, but unfortunately my mind was not satisfied with what I was doing at that point of time, because I was seeing the same patient again and again with same asthma, same fever, cold, and all sorts of chronic diseases like osteoarthritis and all. But the thing was, when the patient come and ask me about why not you give a permanent cure, doctor, because we have to come very often to take the medicine, injection, and treatment. So why not we give a good solution so that at least the treatment effectiveness is lasting longer. But I was not very sure. I was more focused on surgery at that point of time to pursue my career in surgery. But one day, I don't know, to change my course of life, I got information just in the clinic, a small cover thrown out into the clinic stating that there is a acupuncture course in Chennai. Then I thought, why not I go and attend that to see what it is. I was very curious about this because a couple of days or weeks earlier, my brother brought a book from British Council Library on acupuncture, where he could not get the book he wanted, so he just took for fun and he started reading when he was doing his second year medicine. So I also started reading, and it was so fascinating to me, the results and the testimonials what I read through. So then I thought, why not we combine this, and started the pursuit of learning acupuncture. It was a long story short. I landed up in China in the year 1987 and took a course in the International School of Acupuncture in Beijing. It was a 4.5 months to 5 months course, and it was a big eye opener for me that there were about 50 to 60 students. All of them are qualified medical doctors pursuing different methods of treatment in their own country, but they all came here to learn acupuncture. What made them to come here? It is probably the interest. At the time, it was, we did not have television, we did not have any other mode of information to get from. It is only a mode of letter, international letters and things like that. But when I went there, when I met these people, it was very fascinating for me to learn from them a lot of new things that is being practiced in different countries. So I completed my course and came back here and started applying acupuncture, because as you know, acupuncture is no medicine, it's only energy management, manipulation of the energy flowing in the body. And to my surprise, many of the so-called therapy resistant conditions, difficult to treat conditions, like for example migraine, asthma, and all these conditions, they were all resolving, and people were so appreciative of the system when I combined both allopathy and acupuncture. So then I decided, oh, this is a new system, why not we combine these two things? And I started combining in the year 1986-87, and that started my journey towards integrating the different modalities of treatment. Then I slowly started looking. After the introduction of internet, we could know more information about different modalities of treatment and started traveling different countries. And then when I started combining, I was really surprised to get such a good results for many of the difficult to treat conditions. So then I started combining and started my integrated medical practice, which was not only satisfying for the patients, it was so satisfying for my personal soul also, because I was able to clear many of the conditions which it was not possible for me earlier. That is how my journey started with integrating the different medical systems.
Excellent, sir. What an inspiring story for the younger generation today it must be, to go to China in the year 1986, 87, prior to the day of this internet. And so it's really awesome that you can share your story here. Now, this is almost coming to 40 years of practicing, my own story, I would like to share a small tidbit, my mother had frozen shoulder, and that's when my brother, who took him to a Sujok practitioner in Coimbatore. And this is after going to the orthopedic surgeons and after getting MRIs and after using painkillers, he was able to increase the range of movement in a span of 10 minutes to this much. And I was amazed to see that kind of result. That was the first time I heard the word Sujok. Can you please, I understand you also practice Sujok as a therapy. Can you tell us a little bit about Sujok?
Sujok is a very interesting subject, because I'm the person who brought Sujok to India. In fact, I should not blow my own trumpet. I was the first practitioner and I was the first student of the inventor of the system, Professor Park Jehu. And when I was actually very experienced acupuncture practitioner at that point of time, so Sujok was easy for me to learn because I studied something similar to that when I was in China. So Sujok is nothing but hand and foot acupuncture. So with my basic knowledge, a little bit sound knowledge in Chinese philosophies, it was easy for me to understand, learn this. And with the two Korean doctors with me, after I studied, my professor left them with me for practicing. And I went in depth into that, and then I completely switched over to Sujok basically from Chinese acupuncture, because Sujok is a science where it's exactly the acupuncture, but the treatment is being done in the hands and in the feet. We call the micro acupuncture system, and are also called as a remote control acupuncture system. So anything that happens in the body can be treated in the hands and in the feet. And the best part of it is, as Dr. Karthikeyan said, the treatment effectiveness are instantaneous. Rather, within few seconds and within few minutes, you can be able to create a phenomenal improvement in the patient's quality of life, patient's suffering, and make the patient believe that it is possible for them to get out of the condition, because many people resign to fate. Oh, my thing is like this, I cannot come out of this, I have to, for the rest of my life, I have to carry on like this and all. They suddenly feel that, oh, I'm able to get out of this. This sort of a magical impact, we get it from Sujok. So after studying Sujok, probably after 6 months and 1 year of my personal training and practice in my general acupuncture practice, then I thought I have to, as I promised to my professor, because I was the only student when I learned it, so that I'll be able to spread the science to each and every household in the country as well as in the world. That was our aim and the motto in the beginning. And we have been realizing it slowly, gradually. Now we have more than a lakh of Sujok practitioners all over the country, in India alone, and rest of the world also. There is so many practitioners. So I have been very fortunate to be the senior most and the earliest person to learn this and start teaching to thousands and thousands of people. And still, of course, my heart is always towards teaching, but unfortunately, because of lack of time, I don't do it. We have trained a lot of teachers, and it's being taught and practiced all over the country. It's a very simple science, and it's not only for doctors. Of course, in doctors' hands, it is a fantastic tool. But even a normal school student can understand this and learn this and apply it to them for simple conditions, not necessarily for a complicated medical condition, but for simple condition like pain and a common cold or frozen shoulder or knee joint pain, back pain. You can get phenomenal results within a very short period of time. The best part is you can never ever harm the patient with this treatment. So even if you do it wrong, it is not going to impact in your system, because this is such a system where you can impart only a positive healing impact, never a negative impact into the science. So this is the reason behind we wanting to spread the science to each and every household, is that this is safer and this is more like a folk medicine, a part of it, not the advanced level, so that everyone can learn and start practicing and helping them, not practicing, helping themselves to their own people, relatives and friends and things like that. So that is the speciality of Sujok, and I'm very fortunate and thankful to my Professor Park Jevo, who is no more now, and I try to keep up to the promise of also practicing and teaching since then.
Thank you, sir. Another wonderful feather under your cap. Now, for a want of time, we will talk about one more therapy, which again is unique to your practice, and I cannot find any other practitioner doing this in India. This is regarding quantum biofeedback. Your take on things, sir?
It's nice that you asked this question. Quantum biofeedback is the next dimension of treatment. This is a very special treatment based on quantum science. Quantum science is totally different science compared to basic physics. Quantum physics and basic physics are totally different domains, where quantum science people say everything in the basic science is meaningless, and these people say that totally that is a different area and it is not meaningful, because quantum science is the science where anything that happens below the atomic level is considered as a quantum physics. Anything above the atomic level, that is this world, we call this a basic physics. So what we do in the quantum analysis or quantum biofeedback analysis is get into, using a special machine, get into the subatomic space, make an analysis, bring it as a feedback, analyze with the very advanced AI software, try to decode what are the abnormalities that are present in the human being in the physical, emotional, mental and spiritual dimension also. This is a very, very different method of analysis and very scientific. This is not anecdotal. It has been proven beyond doubt, and as you all know, for a long period of time, for centuries, quantum mechanics, quantum physics has not been recognized properly. But in 2022, you all know, the physics Nobel Prize was given to quantum physicists, three quantum physicists in different parts of the world, where they have proven beyond doubt about quantum entanglement. One of the expression of this quantum mechanics and quantum science and physics is this system where we do a subatomic analysis, and the speciality is it's not the physical, it is a physical, emotional diseases, mental conditions, and we can also try to work on so-called spiritual, I don't know whether to call it a spiritual or what we call as the chakras and auras, which are nothing but again really a physics. Chakras are nothing but the scalar waves that is developed in the body, and the aura is nothing but an electromagnetic wave around the human body. So we can either call it as a physics or as spiritual, or anyway, we can, since they are electrical in nature, we can manipulate that also, and we can create a phenomenal improvement or upliftment in the condition of the patient, where we don't actually in quantum physics treat the disease, rather we treat the fundamental cause of the disease, because the cause may be one, but the disease expression may be in different dimensions, like different organs. One, inflammation is the fundamental cause. It could create problem in the liver as hepatitis, it could cause nephritis in the kidney, it can cause nephritis, or in the brain or any other condition, it can cause in the nerve tissues, neuritis and things like that. So we don't treat the nephritis or we don't treat specifically neuritis, rather we treat the inflammation using the quantum biofeedback, thereby creating a phenomenal impact on the symptomatology what the patient has got. So we don't use any pharmaceuticals in this, we try to manipulate the body system or switch them back to normals. Basically it's not disease treatment, it is switching the body from abnormal mode or abnormal dimension to the normal spectrum, switching the body from unhealthy spectrum to healthy spectrum and helping the body to heal, not rather forcing the body to heal using pharmaceuticals. So this treatment or this analysis come treatment is a next level of treatment based on the quantum mechanics and quantum science, which is what the world is moving towards, where we are now coming to quantum computers, and quantum travel also is possible in future, where there is teleportations and other things are also happening, but these can all happen only in the quantum field. So this is based on quantum science. A little bit difficult for general people to understand this, but in the due course of time, people can realize and feel the impact of it.
Thank you, sir. Thank you very much for your detailed explanation. Thank you for detailing all the three therapies today. We spoke about acupuncture. I have been personally benefited by your acupuncture. My mother benefited from Sujok therapy, and this quantum is something which is completely new to all of us, and we are thankful and happy that you are able to share this with us. I'm afraid that's all we have time for today. We would love to meet Dr. Mohan to discuss various other things which he has learned over his course of years in his travels to Europe and US and other parts of the world. We will be coming back with you with all his stories and anecdotes in a later episode. Thank you very much.
Thank you all. Thank you.